Happy Ortho New Year to you, Doctor. It is a fantastically beautiful day before New Year's Day here, New Year's Eve day. It is a pretty day here in East Texas, and I'm getting all sorts of wonderful New Year's wishes from the UAE as we all celebrate a new year full of new promise. And it is indeed an Ortho New Year. I want to tell you about the Element seminars that we're beginning very soon in a couple of weeks here in East Texas. And I want to tell you about the 6 sessions that the comprehensive course offers. The first session is on the gathering the data, collecting the data about your patient, getting to know them, getting to know their parents, getting to know what they're about, getting to know what they need, what they want, and figuring out what's going on with them. The next part of that first session is putting it together in a treatment plan. Once you have the data that you need, and that's going to include x-rays, it's going to include the examination itself, clinical, it's going to include the health history, and it's going to include the molds or models of the teeth so you can do some measurements. It's going to include the tracings of your x-rays so you can determine growth and development, maxillary and mandibular growth and positions and relationships skeletally. All of that is part of your data collection, and then you can sit down and get together your plan of treatment. After you get your plan of treatment together, then we go to what we call the conference, and you might call it something different, but the conference is where you sit with your new friends, especially the mom and dad. The child does not have to be there because you're just telling them what you've found, what's going on with their child, and what you recommend based on what's going on with that child. So that's the first session. And after we talk about how you go to conference, now you've made a friend. Now you have a parent who can't wait to get started. I want to tell you that on a regular basis, almost without fail, when I say to a parent, now that you know everything about your child's needs and possible treatment, you decide when you're ready, let us know, and we'll be glad to get going with you when you're ready to do so. You know what they say? Well, let's get it scheduled. Can we start today? That's what they say. That's session number 1. Session number 2 is on bracketing and banding all the possible well, not all the possible appliances, but many possible appliances that you might be putting into your treatment and into using for various patients. The bracketing and banding, the placement of the appliances, what kind of appliances, when do you bracket which teeth, do you ever bracket primary teeth, if so, why, if so, where do you place the brackets, what do you band, why do you band, why do you not just put a tube on, or why do you put a tube on and not band? There are so many questions that we answer in that technique session number 2. Then the third session is called, I call it Beauty and the Beast. Beauty and the Beast is where we talk about class 2s and class 3s, very noticeable face-altering malocclusions that when you treat, the faces can become so much more beautiful and so much more delightfully charming for the person that has the pretty little face and for their parents, and of course for you to enjoy what happens as a result of what you do. We talk about how to do it. We talk about what to use. We talk about how to go about it, how long it would take, how to treatment plan it as far as what you're going to do first, what your priorities are. Do you expand first, or do you do sagittal correction first, and why? Which one is going to work the best for that particular patient? And then after the third session, let me look here. Then the next session is the 4th is phase 1 and treatment of the early to mid mixed or transitional dentition. And that one is one where we go through how you would approach a child who is maybe anywhere from 6 or 7, usually 8 to 9, all the way to permanent dentition, adolescent permanent dentition, because that phase 1 is going to be a little bit different in its goals, in its approach, in its appliances than a full phase treatment. But what happens if you roll into a full phase treatment? Will that happen? How do you handle it? How do you tell the parent before it even happens? What do you do to make it all come together well? That's the 4th session. The 5th session is mechanics. Boy, mechanics, treatment sequences, how you approach things as far as getting where you're trying to go, not just moving the teeth, but making sure that the occlusion and the beauty have all come together in the very best way possible for that particular patient. The mechanics is going to include some finishing details, some material on detailing, because it's always part of your mechanics. Finally, session 6 is retention, and this is an interesting session because it's not just about retention. It's not just about retaining what you've done. It also is looking at success in orthodontic treatment. What can you expect? What can your patient expect? How long do you keep them coming for retainer checks? How do you weave that into your practice? Whether you are limited just to orthodontics or whether you are general or pediatric dentists and you can put them in with recalls. What should you do at no additional charge? How should you charge for all of these things in the retentive area? And of course, backing up all the way to the beginning, we'll be talking about how to set fees from data collection and records all the way through placing the braces, how much they pay when, and just different options for you to consider for your practice. We'll also be, of course, talking about insurance and how to deal with that. And quite frankly, you're going to hear me talk an awful lot about just getting out of the insurance game. Orthodontics is the perfect place to get out of the insurance game because orthodontics is so often not covered in the same way or even at all. So that's something else that we'll be talking about all the way through. So that's what we're going to do here in our orthodontic new year. We're going to start these sessions and we're going to roll right on through. I think that they're every month to 2 months, depending on the time in between each one. And we will welcome you to the lectures, and then we will welcome you also for some wonderful meals and conviviality, congeniality, and collegiality. How about that? So we look forward to telling you more, seeing you more. Let us know how we can help. So have an Ortho New Year. Signing off.